tongue tie has been something that, child doctors will address an infant, whether they can nurse properly or they can't nurse properly. And that's usually the first place that's identified. You can go from there to a child who can nurse properly and not have any problem whatsoever, to still being tongue tied. And we know that tongue ties, there's actually, not to get too technical, but a fascia that goes all the way from your tongue down to your toes. It's connected all the way straight through the body, okay? And we know that when you have a tongue tie, it affects so many different things. The way you walk, the way you stand. It's caused bow-leggedness, pigeon-toed, all these different things that you wouldn't think had anything to do with, how does that have to do with my tongue? Interesting enough studies have been done and enough tongue ties have been released. And when you're talking about a tongue tie, what is it? What is it really? And it's where from the tip of your tongue, there's a webbing on the back side. If you lift up your tongue, you can see that there. And if it's too tight, that pulls on everything all the way down. And so we go through first, to treat this, we go through the myofunctional therapist to teach you how to use your tongue properly, right? For one, your tongue's been held down in the floor of your mouth. You haven't been able to move it where it needs to go. You can't get the food out of the corners and out of all the areas you need to. And so we train you to strengthen that muscle first. Then we go and we do a tongue tie release. We actually release that. And it's interesting to hear because every patient is different. Every result is different. I had one person that we worked on who had jaw issues, and we had taken her all the way through the jaw. She still had some popping and clicking going on one side, which isn't a problem. People have that. It's just she was completely out of pain and things were functioning well. But we did a tongue tie release on her. She was heavily tongue tied, lisping. And then we did that tongue tie release. She said, it's the weirdest thing. The pain in my shoulder's gone, and I no longer pop on that side anymore. Just from a tongue tie release. Who would have thought? And so we know that tongue tie and that being held down in there inhibits the development of the arch, inhibits the development of your teeth, your smile, your face, your nasal airway, your throat, has so many effects on so many different things. And it's very important that that's identified, looked at, especially in children. And if we can get to it early, that development, their growth, it all changes.